Well, China's capital, Beijing, has closed museums and parks as COVID-19 cases in that country continue to rise. More than 28,000 new infections were recorded on Tuesday across the country. China has also logged its first COVID-19 deaths in 6 months. So should the global community worry about how rapidly the virus is spreading in that country? Let's get you some analysis now. We're joined by Professor Salim Abdool Karim, who's the Vice President of the International Science Council. Prof, great to see you. Thank you so much for coming onto the AM report so early on a Wednesday morning. Almost 30,000 new cases in China. Is this what the graphs were telling us would happen around this period of the pandemic?
Good morning. Good morning to all of the viewers. I think we have to firstly appreciate that while the pandemic emergency, the kind of crisis that we had in 2020 and 2021 is now receding because most of the cases tend to not need hospital care, we are still living in the midst of the pandemic, and the virus is still continuing to mutate. So what we are seeing in China is mainly the BA.5 and its various mutations. So that's the lineage of Omicron that is spreading in China. And the problem that China has is that it doesn't have high enough vaccine coverage, and they haven't had the virus with large numbers of natural infection. So their problem is their older populations will have quite a severe effect. So they have chosen a strategy, perhaps not the wisest, but they have chosen a strategy that tries to suppress the virus entirely. That's not an easy strategy with a highly infectious strain of Omicron. Now, it is of concern that it's spreading in that way, because if it spreads in any country in the world, it's a problem in the whole world, because we are so interconnected. So we have to keep an eye out as to what's going on there.
Can China now backtrack on that decision around vaccines?
Well, China is, let's say, modifying its strategy as it goes along. I think it's going to have to eventually consider what is the best for that country. The issue right now in China is that their strategy of trying to contain the virus in areas using quite substantial isolation techniques, in other words, preventing people from moving and so on, are things we all were using back in 2020 but stopped using.
Right.
They remain the only country using those. And the problem is that it's hard to sustain those economically, from a human rights perspective and so on. So I think China is going to have to rethink it, but probably move in a systematic way, because if they just let things go, there will be a lot of deaths in China.
You're obviously talking about the kinds of lockdowns that we're seeing in China again, Prof. Beijing closing museums and parks. We know here in South Africa the economic cost of lockdowns of that nature. And you're talking about, people's rights as well to freedom of movement.
Yeah, I think we all understood the challenges we were dealing with when we started dealing with the coronavirus, when the virus was spreading very rapidly. It was causing large numbers of deaths. But with vaccination and letting the healthcare system do its job, we've been able to get, in many countries, the situation now is that even when Omicron is spreading, for example, it's spreading right now in South Africa, we have a small spike in cases. We're not overly concerned about it, because we're not going to see a lot of hospitalizations as a result.
Yeah, that's the important thing, isn't it, Prof? The issue around, yes, we're seeing a spike in infections, but the issue of hospitalizations and deaths. As far as you know about what's happening in China, obviously there's been a spike in new infections. They've also seen the first deaths in 6 months due to COVID-19. But what has their level of hospitalizations and deaths been in connection to the earlier waves of the pandemic?
So China has continued to have substantial hospitalizations when it has waves, and that's been part of its problem. And the reason for that is the population distribution. The virus gets into the older population, and so that's why they get hospitalization. But their healthcare system is pretty good, so they have very few deaths, and you can see that in the numbers. For example, right now, in the U.S., there are almost 400 deaths per day from COVID. And China has one death and is very concerned about it. So you can see the difference in the thinking. In the U.S., it's just tolerated. People can just die from COVID, whereas in China, even one death is a problem. So it's a question of policy, it's a question of how you want to deal with COVID, and you can see these two very different strategies.
I mean, 400 deaths a day. Ayanda and I are both sitting in studio here with our mouths agape, just in shock. Of course, the U.S. is a much, much bigger country than we are here in South Africa. But again, I mean, is that on par with where we are in the pandemic now?
Well, you have a real problem in the U.S. in that you have large numbers of people who are just not vaccinated at all. And they haven't had natural infection in the same way that it has spread in many other countries. So you have a challenge, and there, the issue of vaccination is a political one. It's a question of what political party you support determines whether you wear a mask and whether you get vaccinated. So the problem has been that for political reasons, many people didn't get vaccinated. And if they're not vaccinated, then that's the problem. As they get older, they're going to get severe disease. Now, the issue that we have to be thinking about as we look at the pandemic, although the pandemic emergency is receding, we're still living in the pandemic, and that means we have to ensure that we continue our overall strategy to reduce the number of infections. Because, the new variant, which the next one will be called Pi, if Pi ever emerges, it'll cause a new wave. Yeah. Because we haven't had a new variant of concern like Pi emerge in the last few months, we've become a bit complacent. But it can come anytime. This virus has so many mutations. So we have to be ready to deal with it.
So what does that look like, Prof? What does being ready to deal with it look like in a South African context? Because obviously we're not seeing the daily reports anymore, and perhaps COVID-19 has sort of shifted to the back of people's minds. But for our viewers at home, for ordinary people like us, even though the pandemic is receding, what does it mean for me to continue to take the measures that are necessary?
So there are two excellent reports that deal with how do we deal with COVID going forward. And overall the approach is called Vaccination Plus. And Vaccination Plus essentially involves three things. The first is you've got to make sure you've taken at least 3 doses of the vaccine. And if you haven't taken a dose in the last year, you need a booster. So that's the first and essential step that we have to follow. If you don't take a vaccine, then you're dealing with a very high risk that you can have a severe disease. So vaccination is our foundation.
Right.
But we say it's Vaccination Plus. So that brings me to the second thing. So the first is get vaccinated. The second is that you need to know what's the epidemiology. If cases are rising, then you would need to take more precautions. If cases are not rising, if cases are low, then you would have a higher risk appetite. For example, when cases are low, there's no problem with going to the pub or going to a wedding and going to places where there are lots of people who are not wearing masks because the risk that somebody is positive is low. But as cases rise, as they are now, you have to adjust your risk appetite. And the third thing in Vaccination Plus is that implement your public health measures. And essentially it's two things. Avoid closed, poorly ventilated indoor spaces. And if you have to go into an indoor space, wear a mask. So that's really the 3 simple things to follow in order to, live with this virus smartly.
Yeah. So going back to basics, effectively.
Yeah, I mean, everything I've told you is not rocket science. The elementary things, we know them, we just don't practice them in a systematic way.
Yeah. Perhaps useful for us to go back to at least some kind of weekly reporting here in the country, Prof?
Well, right now, we get information on a regular basis. The problem is that people are not testing. So even though their cases are rising, for example, in KwaZulu-Natal, cases are rising quite rapidly, but people are not testing. And because people are not testing, they're just assuming they have Omicron, and they know that it's mostly mild right now. They're not testing. And if you're not testing, it's a problem for us. Because if you don't test, then we don't know what the virus is that's spreading. We need people to test. That way we can sequence the virus and know what virus and what mutations are occurring. So that's our big problem right now. We need more people to test.
I mean, are you actually making that call to people who are watching this morning, Prof, that if you are ill and you do think this might be COVID-19, but it's quite manageable, are you calling on people to actually go out and get tested, even though you're feeling okay? You're not necessarily going to be hospitalized?
Absolutely. I think everybody, if you have symptoms, if you're concerned you've been exposed, have a test.
Yeah.
Test is quite cheap. It's easy to obtain. If you don't test, then you don't know who else you are exposing. If you don't test, you might go and sit next to an elderly person and expose that individual. You don't want to be responsible for doing that. So, do the wise thing. If you think you have COVID, have a test.
Professor Salim Abdool, Karim, it's always a pleasure talking to you. Thank you so much for joining us this morning. The Vice President of the International Science Council, and several layers of advice and analysis there on the stage of the pandemic.